Enriching lives in the community. Health is now a major priority on the international agenda and is an imperative for development. In Andhra Pradesh, a revolution is transforming public health in the rural areas. Interventions such as improved nutrition and balanced diet, access to public health facilities, provision of clean water and sanitation, all of which are basic public health approaches, have had a significant impact on the health of the poorest of the poor in the region. The Society for Elimination of Rural Poverty, SCRP, an autonomous body of Government of Andhra Pradesh funded by the World Bank, is responsible for the implementation of Indira Kranti Padam, the flagship scheme designed specifically to empower the rural poor. In fact, it is a community demand-driven rural poverty reduction program, the single largest, one of its kind in South Asia. Andhra Pradesh has over 850,000 self-help groups with a strong membership of over 10 million poor women living in the rural areas, including the remotest areas in the region. SCRP has worked several of its own innovations into the health and nutrition interventions that directly benefit the poorest segment of its population. Its main objective was to deal with the lack of primary healthcare facilities in the villages. And it all began with a simple belief that good health is essential for a productive life. One such innovation was the establishment of community-run nutrition-cum-daycare centers. The primary aim was to reduce malnutrition among the vulnerable sections of the population and achieve sustainable improvements in the nutritional status among them. There are innumerable examples from across the villages of how the nutrition-cum-daycare centers have developed into a health initiative with focus on balanced diet for pregnant women, lactating mothers and malnourished children. The centers, run as they are by the self-help groups, have come as a boon to scores of poor women and their families in rural and underserved communities of Andhra Pradesh, with dietary diversification such as usage of millets and green leafy vegetables in a daily diet, a sharp decline in maternal and infant mortality rates, and also in the number of low birth weight babies, improved maternal health and the ability to combat disease through better nutrition, set up clean water resources and sanitation, built health awareness, increased wages, reduced indebtedness and significantly empowered the poor. SCRP's approach towards community development revolves around beneficiaries at the grassroots level by assigning them as the key stakeholders. To begin with, the project concentrated on building people's institutions, all oriented towards development through participation. Thus began a marathon exercise in getting the women trained in primary healthcare activities through Community Resource Person Strategy, popularly known as CRP strategy. And it worked. The women honed up their skills in a range of health interventions, nutrition centers, fixed nutrition and health days, health agenda, trainings, health savings, health risk fund, health insurance, water and sanitation, and social mobilization. Once trained, they came to be known as health CRPs. Their primary responsibility was to first introduce health agenda in their regular meetings. Once this done, the women started understanding the importance of and the need for good health in daily life. The health CRPs went a step further by holding sessions to impart health education to the SHG members. The result was noticeable change in their behaviors like personal hygiene, adopting preventive measures like usage of mosquito nets, care during pregnancy and after, care of the newborn, etc. This followed setting up of nutrition centers, enroll pregnant women, lactating mothers and children in the center to get nutritious food, organize fixed NH days in the village, ensure that all the poor and the POP regularly attend the NH days, take care of sanitation and clean water in the villages, ensure ODF villages, and inculcate the habit of savings towards health among the members. The fact that 80% of the health problems can be taken care of at the village level itself has further enhanced the role of nutrition centers. The centers have now become not only a point for delivery of all these health interventions, but also a source of healthcare expertise in the villages. All the SHG members are entitled to get enrolled in the nutrition centers. The SHG Federation takes care of the resources, support and administration, while the project looks after the logistics support. This begins with the building of social and human capital, the first step towards organized social change activity. Periodic surveys are conducted by the members themselves to identify people who have crossed the line of poverty. Once this is done, the health CRPs and the health activists act as guides, role models and functional specialists in sensitizing women on various aspects of health and nutrition in day-to-day living. The center of focus being the pregnant woman and the newborn child. Microcredit plans are prepared to provide balanced diet for pregnant women and lactating mothers for a period of 18 months. That is, from the second trimester during pregnancy and 1 year during lactation, and also for children below 5 years of age. The cost of the diet provided at the nutrition centers is around ₹30 per day per person, which is shared by the beneficiary and the village organization. The village organization's contribution is dovetailed from government programs like the Janani Suraksha Yojana, ICDS, etc. The repayment of loan by the beneficiary is done in easy installments. Armed with the plan, the women members procure groceries earmarked for balanced diet. The daily ration plan is drawn out as per the number of pregnant women listed at the nutrition center. As an offshoot, kitchen gardens have sprung up in and around the nutrition centers. The practice of non-pesticide management in developing backyard gardens as well as kitchen gardens by the members is helping produce pesticide-free vegetables at less cost. The members themselves supply homegrown vegetables to the nutrition center. This contribution helps reduce the cost at the nutrition center. The cook, who is also an SHG member, undergoes 9 days training at the Home Science College to learn various methods to retain nutrient value in the food prepared and the usage of millets in regular diet. She then prepares food with focus on balanced diet as per ICMR standards. She plays a hard and soft rule motivating the pregnant women to have a wholesome diet, so very essential for both mother and the unborn child. The fixed nutrition and health day at the center takes care of the periodic health checkup, immunization and awareness among the pregnant women. The SHG members themselves maintain the accounts and registers at the nutrition center. In order to focus on the POP, SCRP provides 50,000 rupees as POP fund specifically for nutrition centers. Social audit is conducted periodically by the external team members to see if every transaction that takes place is as per the parameters laid down by the Nutrition Center. Further, in order to help the women dependent on agriculture sector who, owing to pregnancy or during lactating period, have to forego their daily wages as they are not in a position to undertake strenuous work, the project has come out with yet another innovative intervention. Formation of income-generating common interest groups, also known as CIGs. CIG is a village organization-centered group activity meant for improving the income generation of the beneficiaries so as to help increase their repayment capacity to the nutrition center towards their diet. It also helps to reduce the dropout of POP from getting enrolled and avail the benefit of nutritional care provided at NDCC. Besides, all the CIG members carry home extra income that directly help their families. All the beneficiaries of the nutrition center, including the health activist, the cook, and the health subcommittee members, are eligible to enroll themselves in CIGs. This is mainly to strengthen and institutionalize the processes required to impart health education sessions as a regular event at NDCCs. The impact of nutrition centers statewide has been tremendous. The opportunities for assured and remunerative incomes are helping the poor beneficiaries in great measure to enjoy balanced diet provided at the center, maintain a healthy life, and overcome economic despair and distress. Gandhiji emphasized that with simple interventions such as hygiene, sanitation, immunization, and nutrition, the incidences of illness can be reduced significantly. This is the basic principle of community health. True to the Mahatma's words, community health is an integral component of the overall development strategy of the nutrition-cum-daycare centers. This can be further observed by comparing the project indicators with the national figures. The roadmap is to establish nutrition-cum-daycare centers in every nook and corner of the state. These are ordinary people who have helped move the MDGs forward towards Destination 2015 and have brought a big difference in their own lives and in the lives of others.